There are very few cures in medicine. Among the hundreds of diseases out there, very few are curable. There's no magic pill out there that will suddenly make it go away. Even the most expensive drug in the world, Zolgensma, isn't a cure. Antibiotics are one such category of drugs that many would consider as a cure. Now, there are more than 50 types of antibiotics used in the US. In this video, I'm going to talk about how these antibiotics can all cause a very specific kind of infection. Before revealing its name, let's get into how this can happen. When we treat an infection with an antibiotic, the antibiotic will kill off the pathogenic bacteria, the infection-causing bacteria. Some of the good bacteria in our colon also die off from the antibiotic. When a lot of the good bacteria die off in the colon, this creates space for a certain bacterium called Clostridioides difficile to thrive, fester, and cause a Clostridioides difficile infection. In healthcare, we don't like tongue twisters, so it is usually referred to as C. diff. Most people with a C. diff infection usually have abdominal cramps, diarrhea, and fever. Hospitals take patients with C. diff very seriously. It's not a code red. It's not a code blue, it's a code brown. Now, C. diff spores in a patient's stool can spread into the surrounding area. These spores can get on white coats, medical equipment, toilet seats, telephones, doorknobs, etc. It is highly contagious, which is why healthcare workers are required to follow isolation precautions for their own protection from C. diff patients. C. diff infections can even progress to toxic megacolon, which if you want to read more about it, I'll leave a link below down in the description. I'll just say that it can be fatal. While C. diff infections are serious and can happen to anyone taking any antibiotic, even an antibiotic for the first time, the risk is low, but not zero. Now, the risk increases with frequent use of antibiotics over time. Older age, being immunocompromised, cancer, recent stay at a long-term care facility, or hospital. And then some antibiotics just have a higher risk of causing C. diff infections than others. Now, just putting it out there, I am not anti-antibiotics. Antibiotics can be life-saving medications. I've actually had to take antibiotics a few months ago, and yes, I was fully aware of the risk with C. diff, but I still chose to pursue treatment. My message is to let you know that C. diff infections exist. C. diff infections are also treatable, however, they do have the chance of coming back. Now, some symptoms that I mentioned earlier, including abdominal cramps, fevers, diarrhea. Antibiotics are known to cause diarrhea. So how can you tell the difference? Was it the antibiotic or was it the C. diff? Diarrhea from a C. diff infection is usually more severe, and most people will have watery stools multiple times a day that could last a couple days. If you have concerns about your risk for a C. diff infection, please discuss this with your healthcare provider. In conclusion, don't get sick. Antibiotics can be good, antibiotics can be bad. Health is wealth. Stay hydrated. Thanks for watching. I hope you enjoyed watching. I mentioned earlier in the video that I actually took antibiotics a couple months ago. Fortunately, I never developed C. diff. I can talk about C. diff all day in a video, but some of you watching actually lived it. So I'm curious. I'd love to hear your experience with C. diff down in the comments. Now, feel free to subscribe because I drink boba every week and something's got to pay for it. I'll see you in the next video.